Hello, everyone. I'm Anita Cicero, Deputy Director of the Johns Hopkins Center for Health Security, and today I will be your Master of Ceremonies for Event 201. On behalf of our center and our partners, the World Economic Forum and the Bill and Melinda Gates Foundation, I'd like to extend a very warm welcome to our audience here in New York, as well as our larger virtual audience participating online today. The goal of the Event 201 exercise is to illustrate the potential consequences of a pandemic and the kinds of societal and economic challenges it would pose. The scenario also highlights the very critical role that global business and public-private partnerships play in preparing for and responding to pandemics. Today's scenario is going to simulate meetings of a multi-stakeholder group called the Pandemic Emergency Board. This board has been urgently convened by the World Economic Forum, and Johns Hopkins has been asked to moderate the board meetings and provide expertise during the board's deliberations. The mission of the Pandemic Emergency Board is to provide recommendations to deal with the major global challenges arising in response to an unfolding pandemic. The board is comprised of highly experienced leaders from business, public health, and civil society. The board's recommendations are aimed at top decision makers in national governments, global business, and international organizations. In this scenario, Tom Inglesby, the director of the Johns Hopkins Center for Health Security, will be chairing the board and serving as the moderator for its discussions. Today's exercise will simulate 4 meetings of the Pandemic Emergency Board, and each meeting will be devoted to one key topic. Each meeting will start with a video and a briefing that will provide the information needed for the board members to engage. Please note, this is not a test of any particular person, organization, or nation. The participants are all playing as themselves. That is, senior business executives, NGO leaders, and government officials. They're not expected to be pandemic experts. We've really asked them to participate based on their own expertise and their best professional judgment. With the exception of Tom Inglesby, none of the participants know any of the details about how the exercise will unfold. The Event 201 scenario is fictional, but it's based on public health principles, epidemiologic modeling, and assessment of past outbreaks. In other words, we've created a pandemic that could realistically occur. And for those interested in our assumptions, we will have a lot of the background research of the scenario publicly available on our Event 201 website at the conclusion of the exercise. The policy discussions, the challenges to be discussed in this exercise represent controversial, high-stakes issues that would require high-level input from business and government leaders. So just a few housekeeping notes before we get started. For our in-person audience, please do silence all your electronic devices, but you may tweet at #Event201. We're going to have a 15-minute break in the middle of the exercise, so please try to confine your calls and work to that time. Because the event is being video recorded and live streamed, we ask that you remain quiet as much as possible and avoid moving around during the exercise. The exercise is going to end at 12:30, and there'll be a luncheon in the cotillion room, to which you are all invited. As you know, there's also an online virtual Event 201 exercise that's happening simultaneously. And for those of you online, and I understand there are hundreds of you, you will be seeing the same news videos and briefings as we do here in New York. But you will engage in your own online discussion in place of watching the discussions of the players here in the room. The topics and the topics and the pacing of the deliberations will be the same, both online and in the room. So, as you can see on this slide, we have an outstanding group of global leaders playing the role of the Pandemic Emergency Board members here in New York. And with that, let's welcome our participants and invite them into the room. Tom Inglesby from Johns Hopkins Center for Health Security, Latoya Abbott, Marriott International, Sophia Borges, UN Foundation, Brad Connett, Henry Schein, Chris Elias, the Bill and Melinda Gates Foundation. Tim Evans, formerly of the World Bank. George Gao from China CDC. Avril Haines, former Deputy U.S. National Security Advisor. Jane Hulton, ANZ Bank, and former secretaries of both the Department of Health and Finance in Australia. Matthew Harrington from Edelman. Martin Knuckle from Lufthansa Group. Eduardo Martinez, UPS Foundation. Stephen Redd from US CDC. Adrian Thomas from Johnson & Johnson. And Hasti Taggi from NBC Universal Media. And Lavin Theroux from the Monetary Authority of Singapore. Welcome. And before we begin the exercise, I also want to introduce Ryan Morehard, who's lead of the Global Health Security Group at the World Economic Forum, and he will say a few words. Ryan.
Thank you, Anita. And good morning and welcome again on behalf of the Center for Health Security, the Bill and Melinda Gates Foundation, and the World Economic Forum. Welcome to Event 201. 201. Throughout our session today, I hope that number will represent two dimensions of our work to strengthen global health security. First, today, there are 200 epidemic events every year, and it hasn't always been this way. The number is increasing, driven by globalization, climate change, urbanization, deforestation, and other trends of our modern world. In other words, we're in a new era of epidemic risk. And the second dimension is that one of these days, one of these epidemic events will be a pandemic, a fast-moving pandemic. And mitigating risk and impact of that pandemic will require an all-hands-on-deck approach. And we know from past responses that public-private cooperation will be essential. We also know from these responses that there are some bright spots when it comes to public-private cooperation, but some real critical challenges remain. But there's every reason for us to work together to address these challenges. For one, it turns out that at $570 billion annualized, the annualized risk posed by pandemics is on par and rivals with climate change, which means that the pandemic risk to lives and livelihoods is at a level that governments and the world's biggest businesses can no longer afford to ignore. And we are counting on this conversation today to inform our work together to improve our collective preparedness and to protect lives and livelihoods from pandemics. And to provide further context, I'm very pleased to introduce a short video now from Dr. Mike Ryan, the Executive Director at WHO and the head of WHO's emergency program. So with that, we'll turn to a video.
Greetings, distinguished guests, and thank you for this opportunity to say a few words at this year's event 201, the high-level simulation exercise for pandemic preparedness and response, hosted by Johns Hopkins Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation. Unfortunately, I was not able to join you today. I'm involved in the IHR Emergency Committee for Ebola, but I had hoped to be in the room with you, because the issues you will be dealing with over the next hours may be tabletop exercises today, but they address real and critical threats which we at WHO take very seriously. Without a question, epidemic risk has become a global strategic concern. I don't think we've ever been in a situation where we have had to respond to so many health emergencies at once. This is a new normal. I don't expect the frequency of these epidemics to reduce, and in fact, vulnerabilities all over the world, developed and developing countries, have increased, not decreased, driven by many, many factors, mainly through human behavior, economic development, population density, and many others. The scenario you will be presented with this morning could easily become a shared reality one day. I fully expect that we will be confronted by a fast-moving, highly lethal pandemic of a respiratory pathogen. The question is, are we prepared to globally respond to the next major pandemic event? Are we ready to cooperate and perform across countries and across sectors to face such a threat? Have we established the surveillance and risk assessment systems, the communication tools, the supply chains, and the business continuity plans that will be needed not only to protect health in a major epidemic or pandemic, but to protect economic development, to protect political and social systems? Do we collectively drive innovation enough to face the evolving global threats which we are anticipating? The nature of pandemics is that many countries will be affected at the same time. This is particularly true with the respiratory pathogen, as they are often transmitted by asymptomatic persons. They spread fast. In 2009, the pandemic virus reached all continents in less than 9 weeks. WHO's priorities are to establish a minimum capacity to detect and respond in each country around the world, to develop global strategies for the containment and control of individual disease threats, and develop global mechanisms to ensure cross-sectoral and multinational, multilateral coordination. Innovation and partnership across all sectors are needed, including joint strategies between global health leaders and the drivers of travel, communication, data technology industries. WHO is working at all levels through a variety of partnerships to strengthen national and regional preparedness, such as GORN, the Global Outbreak Alert and Response Network. Through the PIP framework, adopted by WHO member states in 2011, WHO has secured 400 million vaccine doses for influenza, 10 million antiviral treatments, and 250,000 diagnostic kits for the next pandemic. We have completed external evaluations of surveillance and response systems in over 100 countries and carried out more than 50 simulation exercises at country level, looking for vulnerabilities and weaknesses in national systems. This voluntary, collaborative, multi-sectoral process helps countries to assess their capacities and identifies the most critical gaps within their health systems in order to prioritise opportunities for enhanced preparedness and response. The Pandemic Supply Chain Network, part of the Epidemic Readiness Accelerator, which is a project of the World Economic Forum in partnership with many, including WHO. It's a public-private collaboration to develop a globally connected supply chain that can support health emergency operations during a pandemic. Stakeholders consist of product manufacturers to logistics providers, distributors, and UN partners, including ourselves. Michael Griffin is WHO's focal point for the Pandemic Supply Chain Network, and he is there with you this week. Constant innovation and the use of cutting-edge technology is key to pandemic preparedness. In order to pool data and analytics at a global scale for disease prevention, the EpiBrain initiative, a global data ecosystem, aims to build a collaboration of big data networks to understand and predict epidemics. It supports data science, innovation for outbreak preparedness and response. Despite this progress, there is still much to be done. Cross-sectoral simulation exercises, such as the one you will be experiencing today, contribute to a better understanding of the critical gaps, the cooperation required from global businesses, response decisions required from government and public health leaders to minimise large-scale economic and societal consequences of a severe pandemic. I wish you the best of luck, and we are looking forward to working with each of you to strengthen pandemic preparedness in the future. Thank you.
And our thanks to Dr. Ryan. And with that, here in New York and online, welcome to Event 201.
It began in healthy-looking pigs, months, perhaps years ago. A new coronavirus spread silently within herds. Gradually, farmers started getting sick. Infected people got a respiratory illness with symptoms ranging from mild flu-like signs to severe pneumonia. The sickest required intensive care. Many died. At first, the spread was limited to those with close contacts, healthcare personnel, co-workers, and families. But now it's spreading rapidly throughout local communities.